meaningful participation of women and girls in the design and construction of WASH facilities. My focus is going to be on a project we did in Bangladesh in the Rohingya Response, and this is the social architecture approach. So just to look at the outline of my presentation over the next 15 minutes, I will start with the problem statement, then the design of the social architecture project and actual implementation, move on and focus mostly on the lessons that we've learned that can be useful for other people. And lastly, for anyone that is interested in replicating the same approach, I will give a little bit of the tips for successful implementation. I would like to take this opportunity to acknowledge the donors that made this project possible, the UNHCR, and UNICEF as well, and of course to mention the support we received as Oxfam from the WASH sector in Cox's Bazar in making this project a success. So looking at the issue at hand that led us to think of this project, I will look at two things. First, I will look at generally in WASH emergencies globally, and I'll also compare and narrow down specifically to the challenges that we identified in the Cox's Bazar specific response. So as most of you know, if you've been in the WASH sector, at the onset of humanitarian emergencies, we have a lot of pressure to implement and provide the much needed facilities to the communities and be able to reach the minimum sphere standards. So around the end of 2017 and the beginning of 2018, when the Rohingya Response was being set up, the camps were rapidly formed to meet the demand of the refugees that were coming from Myanmar. And what that normally leads to is a lack of consultation, or if there is consultation, it is consultation that is limited, mostly focused on opinion leaders, which was the situation in the Cox's Bazar response. There was lack of good consultation with users, and especially the women and girls. The other issue that tends to happen in emergencies is the infrastructure planning and design process is mostly dominated by male architects and engineers. This also leads to a lot of gendered assumptions being made by the response teams. And lastly, we have contextual challenges that are specific to a particular area. So for the Rohingya response, what was the issue? Mostly about difficult terrain. So we had steep slopes that were vulnerable to landslides. There was shortage of space and a high population density. So these are some of the issues that we faced specifically in the Rohingya response. So moving on, looking at the challenges that we were faced with, as Oxfam, we came up with an idea to try the social architecture approach in a humanitarian setting. If some of you have heard about the social architecture approach, it has been trialed in urban areas for urban planning, but this is something we wanted to see if we could use it for a humanitarian context. And the goal was to really improve the WASH sector response to the needs of women and girls in particular, because as I mentioned, there was a gap in consulting the women and girls. How we were going to do this was to work with the women and girls themselves, but to be able to bring a different perspective into the design, we wanted to incorporate female architects that had a good background in social design and feminist architecture. So as you can see in these pictures, we have the architects working together with the women and girls and supporting them to really design, to put all the ideas of the issues they want addressed in the facilities on paper and translating that into models that we can be able to construct. So the social architecture project was implemented in 3 phases. The first phase was the formative research and concept design development, and this entailed key informant interviews with staff in different organizations in both wash and protection sectors. We also had the focus group discussions now with the women and girls, and this was done by teams that were trained within Oxfam's protection, gender, and public health promotion. And the phase one ended with a review of the findings that was done by the architects who are female, as I said, with the women and girls. Then we moved on to phase two, which was now the pilot project. To kick off the pilot project, we had a multi-sectoral workshop which brought in all the sectors: protection, gender, shelter, wash, to look at the issues of the findings from phase one, the formative research. That is where we validated all the data and information that we had collected. Then the small team of implementation for the pilot project, which was female architects together with Oxfam WASH team, were able to engage with the Rohingya women and girls to adapt some of the models from phase one and be able to design four facilities that were constructed. And then we got feedback from the users, and there was an evaluation of the pilot project. Then the final rollout of the project, which ended last year in December, was looking at how we can now take in all the lessons learned from the phase one and the evaluation to be able to improve our consultation tools and make sure that we capture the feedback that is coming from the women and girls to do facilities that are that were able to meet their needs. And then also the existing structures that were there, how we could improve them using the feedback that was shared by the women and girls. And lastly, in December last year, we had a final workshop. Unfortunately, because of COVID restrictions of numbers, we were not able to do a multi-sectoral workshop, but we brought in agencies from the WASH sector to consolidate approach and lessons and come up with recommendations, which I'll be sharing in this presentation. So I am going to focus now on the lessons learned, which for us we feel is one of the key things that we would like you to take out of this presentation. So the first part of the lessons is focused on the consultation process. And there were two key themes that emerged under this. The first is looking at the culture within the WASH sector and also other humanitarian sectors. So some of the things that we need to look into and change that we learned from this project was looking at the imbalance that we were talking about. It's a male-dominated sector, the WASH, the shelter site, people that are involved in facilities. Then the question we were asking ourselves is, do we need to engage more females in these specialities, or do we need to educate and change the male that are involved in this sector to understand the importance of the users? And this goes back to our core humanitarian standards, understanding that if the facilities we are building are for women and girls, that we need also to be accountable to them, not just asking them for their feedback, but going back to explain to them how we have addressed their complaints and checking. So as you can see from this picture, we have a male engineer working with a woman inside her WASH facilities to make sure that all the issues that she has, the concerns, are addressed and that he's actually getting it right. There is also the aspect of multi-sectors working together. And one of the challenges we had for the Rohingya response was a lack of space for WASH facilities. So one of the UN officials asked from UNHCR, how come we have space for shelters and not WASH facilities? Is it how we are looking at infrastructure for the users separately instead of looking at it as an integral part jointly? And the other bit that we were looking at is understanding gender and age considerations. So there were a lot of lessons that came through this. The first thing is looking at the sector approved designs. Are these acting as a barrier or an enabler? Or again, is it tied to how the practitioners apply them? Where some of the engineers have no flexibility, they take the designs, they go and implement them, and they tell the users, this is what the sector has approved. Where do we draw the line as to getting our responses first and using something that is standard, and as vis-a-vis listening to users and being able to adapt and provide facilities that they appreciate? There was also a discussion around how do we address the gender needs in patriarchal societies. And this is tied to also the culture within the sector, where most of the practitioners assume that women in emergencies do not make decisions. That norm, how do we change that perception? And how do we encourage that facilities are to be used by all users, and therefore their user feedback is very, very important. And linking also that consultation does play a part in the proper use and operation maintenance. So as you can see, it's not just about consulting male and female. So accepting, like some of the practitioners would say, we have male segregated toilets from the female. It's not just about that. There are also age groups. In the females, we have girls that have different menstrual needs compared to the women. And when we look at men, we could also have elderly men that have got issues like incontinence. So there were all these aspects that came about. So the consultation process led us to learn on changing our culture, as well as making sure that we have understood the gender and age considerations well. For the design considerations, we had quite a number of things. And the first one is about linked to consultation. It's not just about citing the location of facilities, but going deeper and finding out what are the issues of access, safety, privacy, security, and other social needs. Maybe women, for example, in the Rohingya community, what we learned is they also wanted spaces that they could socialize. And so these aspects, when taken care of, are able to contribute to them feeling dignified. And so this also brings the argument about how flexible are our engineers in the field to listen to the feedback, and not just that, but to adapt. And this is, of course, linked to contract management, because most of the time maybe we engage contractors. So how do we ensure that the feedback we give to the contractors is the same issues that were raised by the communities? There was also something we learned around space. So when we talk about social architecture, it's the combination of the social aspects of the users and also the design, the architecture. So not just assuming that if you're going to factor in the feedback from the community, you require lots of space. That is usually not the case in most instances. It is about making the best use of the space that you have. And of course, there were issues that came up around funding, because again, this is another perception that if we do extensive consultation, the users will demand for more, and you require more money to be able to deliver that. It is important for us to remember there are certain ways we can go around this. So for instance, if you look at the picture there, it's also making use of locally available materials that might be cheaper options that the community can easily maintain. And so it's looking at the design considerations, engaging the users, not just for them to cite facilities, but talking to them to design exactly what they have in mind. And so lastly, as a way forward for anyone that would be interested in implementing this in other projects, it is possible to replicate the social architecture approach, because it helps you to improve the user participation in the design of the wash facilities. But what we learned about the consultation process is that it needs to be continuous, and it needs to start pre construction. Before we do any construction at the design stage, it is important to engage the intended users, especially the vulnerable ones that are not able to speak up, making sure that their issues are adequately addressed. Also, it's important